enriched our and specialized enriched our understanding profoundly. Let's give a warm welcome to Dr. Nimesh for another enlightening session today. Thank you, sir.
Thank you. Thank you very much. Like I was saying, if you are coordinating on behalf of your group, may I suggest that one, please request our friends to switch the videos on as far as possible, certainly when they are joining the discussion, but I think even otherwise, you'll get a sense of interacting really when you have the video switched on. And two, if at all you have had, or if you are now able to decide three or four or two or three of your own group, who would want to set the ball rolling by initial comments or what they feel about mental health and especially about mental health problems and solutions for medical students. I mean, I don't mind starting, but I've had enough say yesterday, right?
Good
Yes.
afternoon, sir. My name is
Good
Wafa.
afternoon.
I'm-
Wafa, how are you? You were there yesterday.
Yes, I was. I'm the State Finance
Okay.
Secretary
So
for
do we say Assalamu alaikum or what do we say?
anything, whatever suits you.
Okay. Kemon achi?
I'm not from Bengal. I'm from Kashmir, actually.
You are not from Bengal, you're from Kashmir. Okay.
Yeah.
So then, Assalamu alaikum.
Walaikum assalam.
Right. How nice. Akshat is here. Yeah, I wanted this because at least in a group discussion, I mean, there's no point talking to blank screens, right? Hey, Akshat. Your head is fine, yeah, don't worry. Not
Hello, sir.
You're looking good. You're looking nice. Okay. Also, we have 29 people already. How nice. So maybe some of you, like I've been saying for the last few minutes, maybe some of you, maybe Akshat, you and Wafa, and if you would, if Dhruv and Nave agree, set the ball rolling initially by how you feel about general issue of mental health, but more importantly, mental health problems and possible solutions, or even barriers to it, barriers to solutions, for medical students and resident doctors, interns. See, as you must have realized yesterday, I have plenty to say and I have no difficulty in continuing in a monologue. But that is not the whole idea, right? Hello, Ardika. You were so involved and to the point yesterday.
Hello, sir.
So the idea today, right? So the idea today, as Navya and I had discussed and felt, was that today might be really more of you guys, me just pitching in, and I'm really going to try and be less loquacious. You see, as I often keep saying to different groups for years, if you have a psychiatrist who is fond of talking, you are in trouble. If you have a professor in any medical specialty who is fond of talking, you're in trouble. If you have a professor of psychiatry who is passionate, you're in double trouble. Yeah, so there'll be no end to. Hi, Dhruv.
Hello, sir.
You're coordinating, are you?
Yes, sir. I'm the General Secretary for IMA-MS in Haryana.
Oh, okay. Oh, this is so good, yeah. I didn't know I am at this state-wise network, and this has been wonderful.
Yes, sir. It's
Yes.
wonderful to meet you too.
Yeah, sure, anytime. And today also I'll leave the email and the phone number for WhatsApp. Please, any one of you, for whatever. So, yeah, feel free. Hardika's questions were very, very incisive and pointed and helpful yesterday.
So maybe
One
because
must say this also, huh?
there is this culture in our college, which is very toxic. So when I was interacting with the students of our college, most of the students came up with the thing that they are facing mental health issues. And that was one of the triggers that led us to, organizing this session with you. So that
Okay. Oh, I
students
get it.
are not getting the right platform for discussing their challenges.
Yeah.
And that is
Yeah.
probably because of the stigma that they have, especially as medical students, because, what I feel is that we are less educated about it. And whenever we have less knowledge about anything, it is much more dangerous than having no knowledge. And this creates a problem here. So once we are
Sure.
educated about it, that how do we address people with mental health issues, how do we identify them, and how do we counsel them? If we get the right path to this, I think there will be much more open communications about this topic, and people will
Right.
find solution.
That's true. I'll hold back. Yeah, let's see. But that's helpful, Akshat. Right. Okay, we have this lady who had with us yesterday. So, lady or gentleman. Sorry, this is a bit difficult, huh? Ashwaki Juneja. Oh, that's a lady. Right. Hi.
Hello, sir. Hello.
How
And
are
hello,
you? How are
everyone.
you?
I'm
Nice.
perfectly alright,
So what?
sir. Nice
Good.
to be with you in this session, sir.
I know. All of you have heard of that book. In our time, it was very popular. There was a psychoanalyst called Eric Berne, who posited what's called transactional analysis. So he wrote this book, I'm okay, you're okay. Very popular at one point of time. But I hear what you're saying, Akshat, and let's today try and see if we can at least have some directions for solutions. To me, it seems, and I'll request all of you to, Akshat already referred to some of those, but what's very useful for such sensitive areas is to identify what the barriers are. What are the factors that contribute to not seeking help?
I
Let's see, who else do we have? Yeah, go
I
on, please. Anyone.
Um, Sir, I think I would like to add one thing to this, that
Hmm.
one of the barrier I think is over information as well. With all this content on Instagram and YouTube, everything is considered as a mental health problem, even if it's normal. So, like, okay, I also mentioned that in my question yesterday, that is my loss of focus due to those 30 seconds reel I'm watching for the whole day, or it's due to
I
ADHD?
know.
How it becomes so that
Yeah.
now everyone is saying everything is ADHD. So now, even if I have ADHD, how can I differentiate it from other things? So I think that's one of the
Yeah.
that's one of the modern day barriers, because in our generations we are getting over that stigma where we can easily talk about our mental health. We can easily, like, it's a trend to go to therapy these days, so that's fine. But how do
Yeah.
I know that I'm
Yeah.
not being over
Yeah.
dramatic? How do I know as a person myself? So I think that's a modern day barrier.
Right. Right. Sure. Can I quickly take that a step further just to stimulate more thoughts from all of you, thoughts and feelings both? See, what's also very difficult in today's world for last 2 decades, at least 21st century, is life and career most often requires many of us to do multitasking. So what you're saying, Hardika, is that damn difficulty between multitasking and ADHD.
Not exactly, sir. What I mean is that uh, how, like, sometimes it's normal. Like, as you mentioned yesterday, we should know how to take stress. It's normal to have stress in life, and if I can deal with it, it's okay. But the thing is, how do there's very I think there's a very like silver lining, that okay, this is a mental here the mental health problem starts. I'm trying to focus, I
But
can't. But I'm not even
right.
modifying my habits or anything. So is it me or is it the problem?
Sure. But to continue to link that discussion with what I think Akshat Mittal was saying, see, what you are saying is, of course, correct in itself, but to sync that with what he was saying, um, young people, all of us, any one of us at any stage, certainly young people in a stressful situation like medical education, um, also require to figure out what you are saying for oneself. So either by oneself or with friends or with a counselor, talk about what one is going through, exactly like you are doing, and figure out for oneself, is it normal? Is it, part of the requirement? Is it the current stress? Is it really something that needs help? Now, we all require that clarity and reassurance. And certainly in the situation that all of you are in, So what's being emphasized as need for some kind of better atmosphere may not be for everybody going for treatment, but that opportunity to express, discuss, just like we are having today, you know. So in fact, more opportunities merely like this in itself might be one possible solution. And then of course you need one-on-one. But let's see what others are anything. Okay, we by now have 36. It's 5:13 as my computer clock says. So we'll go by what most of you say, and Drew especially. But I'll really request. Oh, we have two Navyas. How nice. Okay. I'll really request most of you, if not all of you, to switch the camera on. It's a wonderful thing to kind of see, connect voice and name and face, or as please as many of you as you can, as your bandwidth permits. Guys. So Dhruv, boss, what is the final call? Should we have 2 or 3 of your colleagues to at least set the ball rolling, or we take what Akshat and Hardika have said as start of the panel?
Sir, I guess we can start with this thing because I also have some questions about my mental health also. I guess MBBS gives this trauma to every MBBS
Right.
student.
Can I? Right. Something funny but interesting comes to my mind, and before I forget it or miss saying it, like you're saying, it's wonderful that you are. I often keep saying in various public meetings and interactions, one of the commonest experiences that I think we psychiatrists have, at least I've had, one of the commonest is somebody reaches out to you, at various levels and says, "Sir, I have a problem to discuss. My friend has, or my neighbor has." And after half an hour or 1 hour or 2 sessions, the person says, "No, sir, actually it's me." So you kind of seek initially proxy consultation, and that itself is an indication of the stigma. But as you said just now, and as many of you friends have been saying, uh, your subsequent generations are really a lot better in this and in many other respects than our generations were. You guys are much more open and direct about it, which is wonderful. Okay,
Yes,
we
sir.
have Dr.
Even in
Mobit
today's
Acceptance is
Verma.
the
class,
first step.
Hmm.
yes, sir. Even in today's class, it was a PSM class, and teacher was teaching hepatitis, and suddenly, out of
Hmm.
nowhere, alcohol came out of the topic. And even the teacher was saying, "कि first year में students come, they are like, नहीं नहीं हम तो कुछ भी नहीं करेंगे until final year. 80% of students are just occupied with it." Literally, every student in my
Then
class.
let me tell you something. Yeah, yeah. Uh, no, if I get what you're saying right, in the 10 years that I spent on AIMS Delhi faculty about 90s, so about 30 years ago, I realized very acutely, and that's what has uh, increased my interest in this all such exercises. Allow me to express an opinion that may be unfair to the system and to our generation, but across the world, I think it has been recorded and noted, and in this country particularly, that young boys and girls when they join medicine at 16 or 17 or around that age, they are full of buoyancy and enthusiasm and human values and eagerness to learn and what have you. By the time they finish at this end of 6 or 7 years or 10, or if, God forbid, 12 or 13 years if they do DM or MCH, they become quite different. Besides what we were saying yesterday about the maturational process from 16 to 26 or 28, there's something, at least there was, now it's being corrected, honestly, I think. There was and there still is something reasonably, if not grossly wrong, with the medical education system and the way we provide examples to you. Somewhere a lot of those positive values don't seem to continue and kind of get replaced by a lot of other negative stuff. And so I really do believe for a long time that like it is being done now, UG, PG, medical education systems, formally and informally, curricular, extracurricular, really needs more revision. Maybe we don't set good examples, role models.
Yes, sir. Literally, everyone was saying, "Ma'am, stress बहुत है." And we're in third year.
Hmm. Hmm. चलो ऐसा है यार, देखो अल्कोहल और टोबैको तो मैं सच में ना, I look at it differently. As you might have realized yesterday, most of you, I don't scientifically, socially, philosophically, I don't belong to that group of, sermonizing. So I think a fairly flexible, pragmatic, permissive, individual choice-based decisions are okay. Yeah.
But sir, is it
You're,
okay to
you're
justify
laughing, Wafa.
drinking or smoking
Huh.
by saying that we are in a profession which is very stressful? Is it okay to justify it that way?
No, I guess not. No, I guess not. Mostly, as a no, if you ask a direct question like that, no. Because if at all it is stressful, if at all the profession or the kind of vocation that or choices that we make in life are stressful, one must learn to take them in stride, and two, find what can be called as healthy solutions, or if you're familiar with the term that we use in mental health, adaptive solutions, not maladaptive, you know? So there can be adaptive, healthy ways of coping with stress, and there can be non-adaptive, or maladaptive or non-healthy. So you're right. You have a big point there. But then again, you guys tell me. See, one thing that I never, I think, forget to say to almost again any group, but certainly when I talk to parents or medical teachers or people in their 30s, 40s, or 50s or above, is, and I keep trying to say that to myself, I don't need to perhaps, none of us individually or as a generation should ever forget what we were doing when we were your age. Okay, it's all very easy. Generations tend to forget, and I never let them forget. I always remind them, ki agar, you see, one of the commonest dialogues in human history, I think, from the caves to drawing rooms or classrooms or labs is, when we were your age, we were not doing this, or this is not how we did. I think that's a whole lot of BS. Because if only younger people got to know what we were doing when we were your age, perhaps it might be quite a revelation. So one thing that older generations, teachers, parents, whoever, counselors need to realize is that all generations, youth has a different set of issues and manner in which they deal with it. Some of them remain similar, some of them become very different. But using stress as an excuse or as a reason, Akshat, is fairly, forget anything else, non-health. Doesn't help anyone except for justifying. That's for sure true. It's different. Let me put it differently. I do genuinely believe, at least for some decades now, that stress is almost inescapable. Medical students and interns and resident doctors are much more stressed, but if you don't find it too not be sermonizing, but too bombastic, I am genuinely of the belief that I keep repeating at quite a few places. Stress or pain is universal. Suffering is not. Suffering is optional. How much you allow yourself to suffer or use maladaptive, unhealthy means to deal with pain or stress is to a great extent in one's own choice and one's own control. And if it is not in control, seek help. The major point, right? Any one of us at any point of time in life can feel that, okay, I'm not able to deal with what life throws at me, or what the world is doing to me. That's fine. Seek help appropriately. But there's this very old saying, if any one of you has heard it, I think it's British English. If life throws lemons at you, make lemonade.
Right, sir. Also,
Yeah,
sir,
Wafa is
I'd
doing
like
this nice job of exhorting people. Go on, please.
take a moment, sir. We have a Miss Dr. Padma. who is a professor in a medical college at Bangalore. Welcome, ma'am.
Oh, very nice. Yeah, I saw something, right?
I request you to please turn on the camera if it is possible, and we'd love to hear your views on this, ma'am.
Just give me 2 minutes time.
Sure.
Hello? Just
Not
two
a
minutes
Yeah,
time.
sure.
I'll be back. I'll be back.
Okay. Right. Dhruv is saying if we look it on a broader basis, as doctors who know more than anyone else the side effects, let's go on. You want to say that verbally, my dear? Akshat? Oh, no, Dhruv, you were saying that.
Yes, I can say that verbally also. I'm just saying
Please.
that if we look on a broader basis, as doctors, who more than anyone else knows the side effects and long-term effects of alcohol and smoking both, and to actually deal with those patients जो बहुत ज़्यादा खराब हालत में भी आते हैं just because of alcohol or smoking or anything. Still, there is no like decrease in trend also, like nothing is stopping them from consuming all these products. So peer pressure के अलावा कोई और भी तो promotion factor होगा ना, which is promoting this thing. Maybe like somewhere it might be helping them with stress also, I guess, or something.
Sure. Possible stress, possibly misuse of the idea of stress, the sense of like we referred to yesterday, we ourselves do and society feeds it, our sense of omnipotence or being godlike. And so, excuse me, when something goes wrong, we can't handle it. But I want to bring in something else about what you brought up, Dhruv. There is in behavioral sciences and in complete medicine, health, this concept, some of you might have heard of behavior change communication, alcohol, drug abuse, service prevention, HIV, whole lot of areas. How do you modify behavior of individuals, of groups, of communities? And there is this paradigm from psychology called KP or KAB. Okay. The presumption in the 50s and 60s was that if you follow my thought, better knowledge leads to more appropriate or positive attitudes that leads to better practice or better behavior. Okay. It flowing like this, in one direction. KAP or KAB. You'll read this or you'll find this described in two ways. I'm inclined to believe for a long time, and there's a lot of research now in 20 or 30 years, and I'm going to come back to what you're referring to. KAP is not unidirectional. It's not always knowledge that determines attitude, which determines practice or behavior. Ever so often, it's in fact the reverse. The practice of behavior determines your attitude, and that determines your knowledge, especially what you read, what you gather, what you retain, what you retrieve and report. So medical doctors across the globe, having had in their own societies the highest possible rates of tobacco and alcohol, is a harsh reality, although that in some parts of the world is coming down. But the presumption that if doctors have better knowledge, they will behave better is a huge presumption in itself. But let me stop. Dr. Padma is here.
Yeah. Good evening, sir.
Ma'am, good evening. How are you?
I'm fine, sir. Thank you. Yesterday, I happened to hear your webinar talk.
Okay. Oh,
Very
nice.
nice, sir. Very nice. I do keep on
I
learn at many of the topics in pharmacology.
mm.
I am a pharmacologist and a family consultant
Oh, nice.
since
And
about
where
30
in
years.
Bangalore? Where
Sir?
in Bangalore?
Yeah,
Where
I'm in
Bangalore?
Bangalore, North Bangalore, Vidyaranipura, near Yelahanka.
Ah, okay. I worked at
Oh,
Nimesh in the 80s on Nimesh
oh,
faculty. So
okay.
familiar with the Bangalore,
Yeah,
right?
I saw your
But
profile,
please.
sir. I saw your
Right.
profile. Yesterday, I happened to hear your talk.
Right.
And I do counsel these students a lot. So that's why I thought I can put one or two sentences here
Of
with your kind
course.
permission.
Yeah. No, please. And firstly, about what Drew had raised, and I was returning to, how does it happen that medical doctors have the best knowledge and yet they often have the highest rates of alcohol and tobacco? We will not even talk about IMA meetings. Okay,
Yes, sir. Yes,
you
sir.
young fellows. Okay, IMA meetings we will not even refer to.
Yeah,
But please,
that's
ma'am.
true. That's true, sir. So, in my
Salpa hai
perspective,
boda. Now,
In my perspective, see, the problem starts right from first year till the final year. And after final year, they will be having a bizarre reaction as to how to go forward. And that is one more step where they are finding it more difficult. And if they get a PG seat, that is another problem. And if they don't get, it is still more a problem.
Damned if you
Okay.
do, damned if you don't. Right.
Yeah. And when they come in first year, no, they think that world is with them and they feel that they can manage everything. They will come to know the reality only when they face the first year exams, which is not like plus two. So then they start that fear, that a problem of both behavior, mental and physical behavior starts. And they feel that with Google Doctor, they can do many of the things without really consulting the concerned persons, either the peers or the teachers or the proper psychiatrist or whosoever it is. They do it on their own and they land up in a very horrible way that they can neither move forward nor they can go backward.
That's
So
true.
what
That's true.
so what I feel is they have to be disciplined first of all, and they have to be focused. So once these two are done, and most of them nowadays, sir, they go out of the house to study because they want to get the best of the colleges and other things. And in that age group between 16 to 21 is the age group where they're vulnerable to many of the things. After 20, they can understand something. Before 16, they will listen to us. The 16 to 21 is a age group where they don't listen to us, and neither they know it properly, and they are neither focused nor they are disciplined. So, and we parents will be so far off from them that we cannot monitor them throughout the day as and when they are near to us. So these are the problems. These are the problems which are met with students who take admission for MBBS.
That's true.
So
That's true, ma'am.
at this level, it should be solved, sir. Only when it is solved at this level, they are disciplined and focused. And then later on, they will streamline themselves. And nowadays, though, since about a decade, people come for MBBS only for prestige sake. They do not come as dedicated doctors, as we were. We always thought that getting an MBBS seat was a God-sent phenomenon. But now it is only a prestige phenomenon. And they don't... in first year only, they instead of having all those foundation courses, they should have counseling.
Yeah.
So then...
Sure. Can I just join in and say, while I agree with your concern and many, if not some of the observations, I do think that what we might be falling prey to as friends and advisors here, or as management, or as teachers, or as previous generation, is perhaps worth avoiding. Judging or assessing them against what we believe are the values of life. You see,
yes, sir. Yes, sir.
Because
Whatever said
foundation,
and done, that age itself is like that.
I know.
Even if we leave it
What
to
I'm saying,
themselves
ma'am,
also.
what I'm saying, ma'am, ma'am, is slightly different. Allow me to say there's a bit of judgment and generation based opinion is what you expressed. All that they need to do is discipline and focus. Now, if I might say, most of these boys and girls want to be disciplined and focused. The definition of discipline and focus may not be agreed between them and us. Okay. We need to receive. So it becomes very easy to opine, sermonize, advise. More importantly, and this I want to address as the larger issue, please, all of you, please, and like what Ishika has raised in the chat question that I'm going to come to, out of say any 100 of 1,000 persons, including say X number of medical students, many people kind of in the middle of the bell-shaped curve manage well. Some people manage excellently. There are people at one end of the bell-shaped curve who may not be able to, or who are not in a position to manage well. Now, when it comes to mental health concerns, all our efforts at thinking level, at program, at individual level, field level, needs to be for those who are not able to do so.
Yes, yes, sir.
You see, there is a
Yes, sir.
presumption that all of them, because they got good marks and they're going to medical college, will necessarily have everything that they can do on their own to discipline and focus. They will not be able to. So somebody who is
Correct.
not able to do something needs supportive help to be able to do that.
100%, 100%,
That,
sir,
that
100%.
very often is lacking, you see, or missing. Let me come to Ishika's question on the chat. And that's interesting. What Ishika is saying is, let me just go back, because now Hardika has in her style put up a long penetrative question. What Ishika has said before that is, sure, Wafa, you must please bring in your very soon. But let me just, Wafa, do you want to come in now?
No, sir. I think complete with ma'am, and then I'll.
Okay. Ishika said, good evening, sir. I come from an all-girls college, and it's very disheartening that we are facing 1 or 2 suicide every year in our college. There may be some reason they must be facing, but is it something to do with the college environment? And what can we do as a whole college to make it better? Sure, Ishika. But then whatever it's called, environment, atmosphere, milieu, as students, you are not always in control, and there's a whole lot of other people and management who should be more responsible. No denying that at all. But it's also, if you don't mind, Ishika and everyone else, at least for the issues that we are talking about, being there for each other, understanding those who are in distress, like Dr. Padma and we were discussing now, those of the few people who are not able to handle stress, life on its own, that doesn't need great management, right? Even if the atmosphere you believe is toxic, amongst yourselves, is it not possible to try and develop that, right? So besides, like Dr. Padma was saying, seeking help where required. So Ishika, I would kind of not to get into a ping pong, but I would also turn it around and say, what is India? What is Indian culture or traffic behavior? It's we, right? I mean, we all, almost as a rule, blame or worse the Indian traffic and traffic behavior. Okay, simplest example. But who makes that? We all do. If majority of us or most of us start following traffic rules and behave well, then it'll be fine. What's the noise level on a railway compartment or on a bus or even at an airport? We who make it, right? So if you allow and think about it, please, after today also, informally, semi-formally, okay, formally may not be in your control. But if you're finding that environment missing or even toxic, make efforts to turn that around. Of course, there'll be chances for the management to do it better. And if you can do advocacy with, I think since in sequence, Wafa, you are in the chat box. After that, before I come on to Hardika Mudgil's query, and I'll also read that through. Do you want to come in, Wafa, please?
So I think what I wanted to comment on earlier was the issue with the drinking that Dhruv mentioned, where I think it's just a rebound relation that kids form with alcohol or other substances that they abuse. Where I think the first thing that we should go to, what has helped me, I think currently I don't really have a lot of stressors in life, and I think the main reason for that is because I've been able to culminate really meaningful friendships within my college and the people that I live with. So I think primarily if we can do that, I think that helps most people, because, like Hardika said, how do we differentiate between whether we actually have a problem or we're just stressed? I think our own peers can help us best with something like that.
Sorry. Can I come in? Sorry. You did wonderfully. I want to interrupt. Everything that you said, but your conclusion of that first part was to find out, we said to find out, do we have a problem or are we just stressed?
Yes.
But being under stress itself can be a problem, right, to deal with. If you'll continue.
I mean, I don't believe being under stress is exactly a problem. It's something that we signed up for when we, gave NEET, even before we actually gave NEET, when we chose science as our, the sciences as our subjects. I think it's something that we knew would happen. So I agree when ma'am said, below 16 is an age where we're listening to our parents, and above 16, we were, starting to form a mindset. But I think we're old enough to know what we're signing up for. So there is a level of stress that we know we're going to have with academically and forming new relationships with people. I think everybody just gets a little taken away with the seniority and the trend that has formed in the medical colleges. But I don't think it's a problem with our generation as such. I think it's really just the environment of medical colleges, which hopefully as nicer and more sweet people come up into the colleges will change. But I don't believe that that's a problem with our generation. It's just the environment.
Can I talk? Hello? Hello? Yeah. See, what
Yes.
you said is correct. See, after 16, parents also believe that the children should have their independence and they will allow them to go. But that independence should be taken in a right way. And as you told, when you have taken science as option, you know what next. Okay? So you should take it as it comes than taking it as a stress component.
Agreed, ma'am. Agreed. That's what I was
Yeah.
saying.
But most of the children don't do that. They mix up the issues and complain it as a stress component, which is not true, which they should build up along with their peers and the environment what they are in. Then it becomes in a very nice way. They can come up both curriculum as well as non-curriculum wise.
Yes, ma'am. Completely understood. I think, especially from my own experience, and that is why it was so important for me to attend an event like this, was because I don't deal with a lot of stress right now because of the friends that I have. I just have to talk to them for 5 minutes and it goes away.
Correct.
But important as medical students and as doctors that we will become in the future, that we know what everybody else deals with and how to help them out.
Correct.
So,
Absolutely. Absolutely.
Hello everyone, myself Ashita from MMI College. I would like to ask one question that nowadays people are very comfortable talking regarding their physical health, but not with the mental health, because people don't feel that comfortable connection between two, whether it's friendship or not, because in medical college finding a friend is kind of a very difficult thing nowadays, as there is a too much toxicity in the college. And this is, I'm saying this on the behalf, like I am first year medical college student, so I don't know what is the real stress nowadays, like in medical colleges, because in the first year, until unless मेरे फर्स्ट ईयर के फाइनल एग्जाम्स नहीं आएंगे, as you said मैम, तो मुझे नहीं पता चलेगा what is actual stress. But still that toxicity hits different mentally, very different. So how to handle that toxicity?
I think to you and the group, I lost my connection, but I'm back. I heard Ashita, part of you. I'm on my phone now, so we may not have the full screen. At least I don't have the full screen. But if I heard you correctly and well, what you're asking is what Dr. Padma was saying too from Bangalore, right? There is something that the first semester or the first year and the first set of exams and tests seem to hit young medical students about. I want to say to Dr. Padma then also, I mean, her time, or I did MBBS or MD, maybe a little even before that, there were not even foundation course.
Correct.
So we can't hear you. You've been muted. So if you could unmute yourself.
But at foundation courses, including behavioral sciences, I'm sure, as Dr. Padma says, there should be a little more openness to seeking help, talking about one's own state. as I found, it was so unfair to throw young boys and girls straight into anatomy dissection halls with cadavers. Okay, I'm sure you face that too. So yes, there is something about medical college training that for sensitive people. Again, I want to keep going back to that bell-shaped curve that we had referred to yesterday, and let all of us please remember. There are some amongst us at different points of time uh, who are more vulnerable, who are more sensitive, who may be more fragile. That's not a sign of weakness, especially about this being emotionally sensitive, being vulnerable to human suffering, or not being able to handle dissection hall cadavers like Munnabai MBS shows very well, is not a sign of weakness, right? People who are sensitive actually need more strength, have more strength. Uh, but yes, can we again informally, semi-formally, formally be more sensitive to that? Even within your dissection groups of 10 or 15 in your class, in your hostel groups, can we be more non-judgmentally, neutrally be sensitive to somebody who is perhaps suffering, some signs of being under stress? Like I think we had covered yesterday, again, very briefly, do's and don'ts. Don't judge. Don't ask probing questions. Never, ever, I would say, as a friend or as a counselor, even raise the question, why? Why are you feeling this? What happened? Why and what are stupid, non-helpful questions? How are you feeling? Would you like to discuss or would you like to share with me how you're feeling, what you're going through? Okay, I will repeat. Any one of us, but certainly you as friends or peer counselors, probing police investigating questions are actually naive and worse. So it's not about what are you going through, what happened, tell me what happened, why don't you tell me, why are you feeling like this? Are bad questions, are bad probes, are bad initiators of communication. Actually, just helping to say, look, I'm here today or in the next few days at some point of time, would you like to share? Doesn't come easy. Doesn't come easy or natural to many of us. For some of us, it may be easy and natural. If it doesn't come easy to you, don't try it too much. Let somebody else do the counseling. Also realize for yourself, not all of us are meant to be that by natural persona. But really, that is very important. Let me give you an example about the sensitivity issue. I don't think I covered that slide yesterday, but I have this wonderful slide, unfortunately, from a European or American setting that you will, I hope, understand by my description. The cartoon shows two ladies sitting on a park bench, apparently in a temperate climate, and one is saying to the other, why are you feeling depressed? Why are you feeling sad? Life is so wonderful. Everything around is good. We have everything. Why are you feeling sad or why are you feeling depressed? And the other lady turns around and says, why are you feeling breathless because of your asthma? There's so much of air around. So it's not the availability of air or availability of amenities or comforts or money that matters, or even human contact. That person who is feeling stress, who is undergoing whatever psychological problems, including syndromal depression, is aware of all that, is feeling whatever he or she is feeling in spite of that. Whatever 8 or 9 people can enjoy life around, that one medical student colleague of yours, long term or maybe those few days or that weekend, is not able to feel the same. Now that differential experience, that sensitivity of the experience of those people who are vulnerable, those who are going through difficulties, needs to be really understood at a very deeper level. And that is where why and what questions are bad questions. Okay, Hardika, do you want to come in? I don't think we have done with your even first question. I'm sorry, I'm not able to connect on my laptop, and so I don't have the larger screen with me. If you will please get on. Yeah, any one of you. Hardika, Akshay,
So firstly,
Wafa.
Ishika has asked Ishika is asked, sir, as everyone and other student is using a word toxicity, I wanted to ask in your times when you were doing MBBS, the toxicity exists then as well. How were you coping with it, and how was the behavior within the batchmates and colleagues, so that we can learn something from your experiences as well?
Okay, if I got you right, you're asking about what Dr. Padma did 35 or 40 years ago, what I did 50 years ago, right? Not a great example to go by, firstly. What we were doing may not always be right or correct or healthy or adaptive. Really, jokes aside, and I don't mind discussing and sharing more, but what I really think is, again, I keep going back to the bell-shaped curve. Amongst yourselves, in your own groups, in your own class, in your own college, across colleges, you'll find examples of individuals and subgroups handling it well, adaptively, healthy. There'll be some people, middle of the group, who will kind of go along, with some stress, constant cribbing, and they'll still perform okay. So best is to learn from each other, amongst yourselves, right? Healthy ways, unhealthy ways, adaptive, non-adaptive. Sure, there'll be enough reason to not fall prey to, and I mean this seriously, with all the liberal, personalized, permissive view that I put forth to you. Alcohol, tobacco, weed, and God forbid, other hard drugs are easy to fall prey to. And admittedly, they provide good prompt relief, or at least escape. Oh, there needs to be caution and carefulness exercised by young people, including medical students themselves, not to fall prey to that. Right? There are easy things that you might fall to. Try and avoid that for sure. But really, I do believe that with this kind of interest, if you all can in your own places develop informal or semi-formal, forget formal, official, uh, peer group help, just reaching out, create an atmosphere where you at least talk about your distress. Tell me if you all, I'm very keen to learn since yesterday and today, but I'm kind of curbing that. There is never a unidirectional process. I'm very keen to learn besides what I've already learned in those 2.5 years of the pandemic. But at least I want to ask this question for reflection, if not answer somewhat. The pandemic has actually brought psychological issues more easy to the center stage, also made it more acceptable to talk about distress or depression, is it not? My sense is, why don't you medical students of today try and capitalize on it and build more strongly for your own health and for the larger society that you are going to be a part in your career, right? This that human race in society has had one of the negative spin-off, positive spin-offs of the pandemic. Don't let it flicker away. This is the time, 24, 25, 26 calendar years, is the time to make all efforts to let that advantage become multiplied. Create an atmosphere more and more where your own friends, your colleagues, and thereby in the society that you will make, you will have a more neutral, if not positive, milieu and atmosphere for sharing distress. We didn't have that. Akshat, if you ask me, it was terrible. Like when Ishita Malik asked, I can't forget. I sometimes actually have to try and make an effort. The first professional experience that I had, one of our own classmates, dissection batch mate, in that group of 18 that we were, right? Died by suicide in the hospital campus. It was very difficult. We couldn't even understand how and why and what happened, right? So all generations, all batches have gone through that kind of experience. And it was, don't forget, 40 or 50 years ago, the Indian society was very different. It was much more patriarchal, it was much more hierarchical, it was much more controlling, it was much more moralistic, it was much more judgmental, and a whole lot of positive things that today you are handing society off. Even if you find your college campus toxic or no, difficult. So Indian society, by and large, is changing for the better. Some parts not very good. Try and build on, really. This sensitivity that you have all shown today and in these two sessions needs to be built on. It shouldn't be lost, especially this. Your group of, I am a medical students network of Haryana, at least, Does anyone have any response to that before we take Hardika on? And I'll try and get onto my laptop if I can again.
Till then, sir, I'd like to add what you said about COVID. I feel there are
Sorry?
three major things to that.
Will you all
Firstly,
speak up a bit louder? Maybe it's my problem of the phone. Yeah.
yes, sir. So, firstly, I think it was because of the negativity, people falling sick, our, our family members, our friends,
Right.
who got prey to the pandemic. Secondly, I feel that people got much more introvert after these 2.5 years of pandemic because they were kept to themselves, bound in a setting of their
Yes.
family. And
Yeah.
we as teenagers, we do not have a habit of discussing things with our family members. We feel, because of a generation gap, that they won't understand things. So especially, we as a generation grew out to be introvert here. And similarly, the third reason, sir, I feel is that we were
You
stuck
from the
much more
laptop
on
in a minute.
social media, and
Yeah.
whatever social media fed us, we blindly took it inside of us. And that created a mindset which was not very healthy for many of us.
I think you are correct.
I respond to that and for everyone. And then we'll possibly get Hardika on. Describe two things. And I hope I got you at least partly correctly. One is that for many of you who had perhaps not even joined medical school at that point of time or were just joining, like many of the people around, pandemic and its negative effects were too overpowering. And so for most people, by now, the tendency is to forget and overlook that part of traumatic experience of 2 or 3 years. While I respect that, if I got you correctly, I am asking and make an attempt getting my use of the term positive spin-off. A whole lot of negatives that happened here indirectly or larger. But can we look at this phenomenon of how the society is now more open to talk about psychological distress? You can at least say, I'm not feeling good, I'm feeling depressed. That positive direction that psychological issues have taken in your own interest as a group of medical students currently and as future important citizens, would you like to make, as you are doing through these 2 days activities and this week, make a more specific effort to capitalize on it, to gain more from it for the society? Does that make sense?
Yes, sir, most definitely.
Yeah. So a little more effort at that. It may not come naturally. On the laptop, switch this off. Okay. Let me get off here first. Okay. Can you hear me now? Will you?
So there is some problem with your connection, I guess.
Sorry.
So there is some problem with your internet connection.
Oh, is the voice not audible clearly? I'm sorry, some problem. Okay. Mona Lisa, if you are coordinating from ClearNet, help us if you can and keep guiding me. Hmm? Are we connected? Shucks. Shucks. No? Okay, bear with me. I'll at least get you the phone on my phone. Oh, in a minute. Okay, will you confirm? Will you confirm if you can hear me?
Yes, sir. Now it's fine. You're able to hear and see. So your mic is off. Excuse me, sir. Your mic is turned off right now. Can you please switch it on?
Okay, thanks. The apprehension that I had even during the epidemic was that the newfound acceptance of psychological distress by human race and Indian society may end up being temporary. See, people easily tend to forget after 2-3 years of such mixed experience. In trying to forget and suppress the negative, they also undo the positives. I am putting forth an idea to all of you young people to say, please don't let that happen to many issues like this. See, that hygiene is important, that your own behavior is important for your health, that psychological issues are okay to talk about, that distress is to be accepted as normative. All of those positives, let's not let the society not forget and dump them once that the crisis is over. So in your own ways, in your own situations, can you try and make conscious, deliberate, concerted effort to see that that does not happen? And that's very common. With traumatic experiences, human race will tend to forget, right? As a coping style. Any views on that, if at all? And then Hardika, I think you have had 2 questions in the chat box. Or anyone else who wants to come in through, where do you coordinate?
Right, sir. I think that the take-home message from this part of the conversation today is that we should inculcate the habit of being more open about and more vocal about mental health disorders and coming up with solutions to them, which should be on a permanent basis, which should be on a regular basis, and we should all give in our efforts towards this.
I really very passionately believe, allow me a few more sentences. For a minute, I'm also a huge history buff. For a minute, go back 100 years. Okay. You are mostly people born around 2000 or a few years before that, right? 1990 or 95 to 2004-5. Now, 100 years ago, the youth that was born around the turn of the 19th and 20th century also had trouble growing up. Please remember, and let me remind you, the First World War, 1914 to 18, the Spanish epidemic, and then the Great Economic Depression. And the people actually.
So your voice is breaking. Can you please check the internet connection?
That globally and you generation of what you I'm really sorry, but I'm back again. Did that make sense to some of us?
Yes, sir.
Anyone wants to come in? Dhruv, Hardika, Akshat?
So you're really right in this.
Sorry, you were not audible.
Okay, I'll tell you again. Can you hear me now?
Yes, sir.
Did you hear the part of my analysis of youth 100 years before you?
No, sir, not completely.
Okay,
Your voice.
I'll repeat, not a problem. If I'm audible now, I
Yes, sir.
recognize that your generation, medical students or otherwise, went through a very difficult period at a very tender age. That both Dr. Padma and I have anyway said, this is a very tender age, growing up adolescence, all of that, right? You all went through a very difficult period of the pandemic in your growing up years, and that can be traumatic. But I really, as a history buff, have looked at it this way. 100 years ago, people who were born between 1895 to 1905, who saw the First World War, then saw the Spanish flu pandemic, then they saw the American Great Depression and poverty, then they saw the Second World War. And yet, that generation, 100 years before you, made a very good, by and large, very good world post World War II, 50s, 60s, 70s, and onwards. So traumatic experiences, even collective or series of crises, make individuals and groups and generations stronger. Does that get across or make sense?
Yes, sir.
Here is an opportunity, I think, for the young generation of today, globally in India, and certainly medical students like you, to actually uh, convert that set of traumatic experiences for yourselves and for your group and for the society to a more resilient individual self and society. We haven't since yesterday talked ever about the resilience phenomenon, have we?
No, sir.
Human resilience, both individual, psychobiologically, and in our society, family and socio-cultural systems, uh, making better resilience is a huge value. And if you recall your own or your family's or your neighborhood or country's experience during the pandemic, you will feel what I'm putting to you. A whole lot of resilience to handle problems, to handle them, stress, perceive the stress, but do well. Is that making sense at all?
Yes, sir, it does. However, I have like two opinions on this. Number one,
Yeah.
with the suicide rates increasing so much, so what is our fast track option for it? Like every minute we are losing a life. So do we remove the triggers first or we build resilience first? Because building resilience would take time. So we are losing a life on that. So
Sure. Well, go ahead with your second point. I'll remember to do this. Yeah.
answer for about like what you mentioned about history and how experiences made our like precedents like stronger. So do you think there is some biological part to it as well? Like earlier people were believed to be healthy. Nowadays most young people are suffering from hormonal imbalances from various medical conditions, and moods is just neurotransmitters and chemicals as medical students we know, so that's disturbed. So is there a
Let me,
genetic kind of
let me
predisposition
address
to
the
that?
second part first. Again, I don't know if anyone of you has read, but nearly 100 years ago, there's a guy called Aldous Huxley, Huxley, Aldous Huxley, who wrote a book, Brave New World, in the early part of the 20th century. And he analyzed the medical world and what medical science and society interaction is doing. Okay. But one very crucial thing that he said in that book, Brave New World, was, and this is nearly 100 or 100 and odd years ago. Okay. And that responds partly to what you said in your second part. Aldous Huxley said at that time that medical science has advanced so much by now that hardly anyone is healthy. So the more technological advances and diagnostic lab indicators and awareness become available, we find more and more disorders and unhealthy care conditions. That doesn't necessarily mean that we are not behaving responsible or we are unhealthy. There is certainly in youth and younger generation some parts which are becoming worse, but please be sure, these comparisons are very, very balanced and difficult to draw one-sided conclusions from. Okay, it will depend on each one of you and this generation. Uh, your first part is very crucial. See, the difficulty is I don't know if anyone of you remembers or you've been through maybe early triage, emergency rooms, or what is unfortunately called casualty in most medical college hospitals, casualty services, it's a bad word, is emergency services. There is a triage. At the peak of the emergency utilization, if 10 people end up in 15 minutes, how are you going to decide which one to attend to first? Even in human priorities, as a group, as a nation, for you individually, those priorities will remain. Like you said, if you're losing one life every hour, if you're losing one or two suicide, like somebody raised earlier in a medical college every year, resilience is something that comes quite naturally, psychobiologically. Our family and social systems actually give it to you well. Those who are falling through the cracks, those people who we are losing, sadly, those young people, or those who are continuing to suffer, not getting help, is our responsibility, sure. Building resilience and attending to people who need help need not be two separate, mutually exclusive exercises, Hardika. It's all part of the same gamut of things, if you get
Yes,
what
sir.
I mean, right?
Yes, sir, I do.
Hannah,
Uh,
I'm
And
sorry, I'm not able to see the chat box, but please come on board, switch on the camera,
sir,
talk
next
away.
question was asked by Mehsheed Farooq. I'll read that to you. I think
Okay,
he's not comfortable switching off
okay,
on the camera. So his question is, throughout the talk, I kept hearing the approaches to the solution sit around the idea of approaching peers and seeking counseling, and it painted a picture of getting help from others. What I want to ask, sir, is that what can a student do to work on his or her issue himself or herself? Because we have heard of things like meditation and journaling. So, can you please shed light on the feasibility of this approach?
very, very nice. Thank you. Thank you. Although I didn't register the name, thank you very much. Yes, by and large, for all of us, again, especially for young people, those whole lot of, besides the two that you mentioned, journaling, yoga, meditation, a whole lot of other healthy lifestyles that I'm sure you know enough about and you keep reading on the social media, is good to do. I only one or two cautions. One, and for young people also, and I have learned this in the last 30 or 40 years in psychiatry more and more. There are situations and conditions for many people, especially young persons, in which meditative exercises or yoga, while good for most people, may actually be non-helpful or even counterproductive. So be careful. For example, if you happen to have too much of anxiety, uncontrollable, or too much of severe sadness or depression, at those points of time, trying to meditate, be chanting mantra will not work. I hope you're all clear enough. And if you're not, let me emphasize, merely physical exercises as shown on the reels and television is not you. Physical exercises, some healthy lifestyle, meditation, chanting, whatever, all of that together. So if you have severe anxiety depression, don't. If you have overthinking, as most young say today, directly by itself, meditation will not help. Seek help first or help yourself with those symptoms first, then get on to meditation. So while what is very crucial, and this is a very sensitive subject, fortunately we are on virtual, not in physical, but even then you couldn't have reacted too much. But one huge issue, friends, is sleep-wake cycle. I have a feeling that if my colleague from Bangalore, Dr. Padma, if she's around or if she were around, she might have a slightly different view than what I'm going to express. I do believe that while sleep-wake cycle and sleep hygiene is very important to maintain what our friend raised about self-help, forget seeking help from outside or helping us. But yes, all generations, because of various reasons, valid or not so valid, have their own sleep-wake cycle issues, okay? It's never an easily settled matter across generations within families. It never was, okay? All generations have had their difficulty with their seniors about when to sleep and when to get up. Early to bed, early to rise, the British saying 80 years ago, almost nobody wants to follow now. But for your own self, in terms of your own studies, your concentration required, your habits, develop some sleep-wake cycle that is stable. One. Two, do not get to be unknowingly, unwittingly a slave of the mobile phone or technology or social media. Okay, please be sure, I am the first one to recognize that to lambast or to malign social media or today's youth about social media is totally inappropriate. It's a huge technological advance that you require, that you benefit from, and more. But for your own selves or for each one of us, we'll have to arrive at what is suitable and appropriate for one's own lifestyle and needs. So if you have classes at 8 or 8:30 or 9, and if you're going to be sleeping till 2 or 3, with mobile phone or technology, and then get 2 hours of sleep and go, that is likely to create a problem. This is not a judgment from an older person. This is a biological scientific fact that I'm referring to. So without getting into more details for now, look up sleep hygiene. What is considered sleep hygiene adapted to each individual or subgroup or society? Think about it, plan, develop a sleep hygiene and sleep wake cycle discipline, if not a 24 cycle discipline that is suitable for your lifestyle and your health needs. No judgments here, no opinions here, no upadesh or gyan here, be sure. But yes, there is a lot of value for self-help. The only major point, and this young gentleman, I think, is pointed out very correctly, what we have perhaps focused on more is beyond self-help, what can one do for helping others or for oneself to have the courage and the comfort to step out and seek help. But sure, as I said yesterday, and I'll repeat one more time for those who are not here or for all of you, 4 stages: self-help, reach out to family and friends, seek semi-formal, informal help from counselors, from whatever systems. Only at step 4, seek formal help. So a whole lot of issues about self-help, and especially in adolescent lifestyle, to say what is good for you and what not good for you. But yes, by and large, you decide what is good for you, not for any one of us to decide for you. Does that make sense?
Yes, sir, very rightly tackled.
Yes, sir, it does.
So next we have a question from Ashwaki. As the discussion is going on and we are getting the idea that one should approach peers or friends to take their help and cope up with stress, I would like to ask generally, it's seen that students feel a bit uncomfortable in opening up to anyone regarding their issues. As Dr. Akshat also pointed, that pandemic made people more introvert. Also, in this, the factor of social stigma, like what people would think of them, comes. So how to cope up with that?
Adhika or anyone?
Yes, sir. I would repeat that again.
No, only the last part.
Yes, sir. So in this factor, the factor of social stigma, like what people would think of them, comes. So how to cope up with that?
Sure. Good one. One, I've said this so many times, so I'll just say it in one sentence. All of you together will create a social media situation for you else. Normalize help seeking. But two, okay, I'm going to be blunt here, and get me wrong, any one of you, for yourself or otherwise. If I need help, and if I'm convinced that seeking help is okay and seeking help is necessary, damn the stigma. People will believe, society will believe what they want to. Totally stigma-free society for all issues concerned is a utopian dream. That does not happen, will not happen. We should all try and see that stigma is less in every area, not just mental health, any such area, sexual health, disability, whatever. But what is more important? Let each person, each of you young people, Those who need help decide what is more important, my own health and my well-being and my shaping up in this phase for a good career and life, or will हमारे जमाने का बहुत बहुत फेमस किशोर कुमार का गीत है, कुछ तो लोग कहेंगे, अमर प्रेम. If you keep worrying about लोग क्या कहेंगे, and that's inappropriate. Please get over that. Whoever needs help. Did that get across?
Yes, sir.
वो
It
किशोर
just
का
cleared
गीत
up.
आप लोगों की जानकारी में है या नहीं है?
Yes, sir, definitely.
And it was a fab film with great numbers. लोग क्या कहेंगे ये छोड़ो यार. I know it's important. I'm not poo-pooing it, but decide for yourself. Okay, guys, if you, I'm since I'm not on laptop, I hope you have, but if you don't, I'll repeat my number for WhatsApp as well as my email. 9810797933, please. Okay, feel free to WhatsApp. And my email is very simple. How many of you know what a shrink is? Do you know the concept of shrink? Okay, most of you don't seem to. American society very pejoratively with negative loading calls us psychiatrists and clinical psychologists as shrinks. There is a story behind it. If you want, I'll tell you that briefly. But so my email is very simple. shrinknimesh@gmail.com. Okay, learn to use humor self-effacing. Learn to make fun of what people make fun of you about. Okay. One of the highest forms of humor. One is humor itself is very good. Sensible, mature humor that's not hurting or harming anyone unduly is very useful. The most adaptive coping mechanism. Okay. Whatever level. And self-effacing humor, even better.
Yes, sir. That's actually the new Gen Z way of dealing with stress. We call it like trauma response.
Yeah, sure. I'll tell you quickly why we are called shrinks, and I'll give you a sense of also where psychiatry has moved. 150 or 120, 100 years ago, even in the best of the developed societies, people with gross mental illness, like our society still believes, they used to be seen as people who have got evil spirits, upri hawa aa gayi hai. You know, the skulls have grown big because evil spirits have entered. Okay, so scientifically, what used to happen is people, either they would burn a hole in the skull, like neurosurgeons do sometimes still or used to do, or actually put your head, that person's head, in a device and the device on. So the head and this way. Okay. Shrink. Negative towards persons with mental illness, dealing with mental illness, including psychiatrists and psychologists, is universal, maybe less or more. Okay. So don't try and fight this stigma, try and reduce this stigma, but don't get preoccupied with stigma if one needs help for oneself or if you know somebody who needs help. Yes, help that person neutrally, supportively to overcome the stigma and seek help. I told you yesterday, if some of you did not register or are new, please understand, and that's a worrying feature. There's 80% treatment gap in the society. People with mental health problems who deserve diagnosis, who can benefit from treatment, not reaching any mental health service. 80%. So there is a long, long way to go for all of us. And you, like I keep saying, and this is again not sermonizing, I'm just expressing a thought and a passion. Young people all through, and certainly young professionals in the field of health, medical students, can be one big group for that social change process. For yourselves, helping your friends, saving lives, and generating a better, more positive atmosphere for persons with mental health issues. I'm so sorry. I'm also missing the charm of interacting with you on a screen with, all benefits of virtual meetings. I just have this screen on my phone that I'm trying to talk to. But,
no worries, we'll try to organize an offline meeting very soon. An offline
that
session where we
also,
can discuss in person.
yeah, sure. That'd be very nice. And of course, more online as and when. Yeah.
Definitely, sir. Definitely.
Okay. Is Dhruv around, or shall we just? It's about 6:25. Dhruv or Navya around, or will you Akshat just wrap up? Thank
Yes,
you,
sir.
guys. And please feel free to write.
Surely, sir. So for all the questions that are remaining, we are really sorry that we are running short of time. But you can always reach out to us and Dr. Nimesh sir directly with any of your problem, and we'll collectively work towards finding a solution. And consider this a safe space to discuss your issues, because we are all sailing in the same boat. And uh, as sir said, and as Dr. Padma also mentioned, that mutual help and talking
Akshat,
with
allow
basis
me. Can I butt in there? Can I butt in there? Akshat, sorry. Something very important to my mind.
Yes, sir.
You
Yes,
said
sir.
very nicely, we are all in the same boat, and in the pandemic, a whole lot of webinars talking about the same. It's like different. It was true in the pandemic issue for human existence, and for all of it may be very relevant for self and for others. I'll modify that. We're all not possibly in the same boat. We are in the same storm in different boats. So that old English saying, even all of you, see, obviously each one's circumstances are different, you have different struggles, So I repeat, we may be or we are in the same storm called life, and especially adolescence, but we are in different boats. So while similarity of solutions does exist, trying for solutions. Sorry, Akshat.
Thank you for correcting, sir. Now that you mentioned it, I think that is the right thing to say. So thank you very much, sir. And that's the reason that we need professional guidance, all our times. Yes, sir. So with this said, I'd like to thank Dr. Nimesh Desai, sir, for joining us in this today's session on mental health issues, and seeing such great response. I'm very sure that we'll be joining with sir very soon again to take more questions like these and to interact in such healthy discussions. And I would also like to thank Dr. Padma for joining. I'd like to thank the whole ClearNet technical team for the help on our backend and the technical end. I'd like to thank the IMA MSN Haryana Mental Health Subcommittee, Hardika, Navya, and Wafa for organizing such a seamless event. And lastly, I'd like to thank all the delegates who joined today in this discussion and shared their views. Thank you everyone for joining. Thank you so much, sir.
Bye. God bless. Have fun.
Bye, sir.
Thank you
Thank
so
you,
much,
sir.
sir.
Enjoy life.
It was
Enjoy
nice
Thank you,
meeting you,
sir.
sir. Thank
Until
you.
next time.
life.
Yeah.
Bye, sir.